Hi, welcome to Urgent Care. My name is Amal, and I'll be your nurse today. Have you ever been here before? No? Okay, we're just gonna go and fill out your medical history form. Before that, I will need to see your license and insurance, and we do need the copay up front. Okay. Thank you. So we're just going to fill out this form together. Everything is confidential, so don't be worried. So we'll need your name. Okay. And today's date is your telephone number. It can be your cell phone. If you have a landline, we prefer that, but we realize a lot of people nowadays just have cell phones. Okay. Okay. And your date of birth. So that would make you, okay, good. And they checked your height and weight before you came back here? Okay. She handed me that already. And your height and weight is fine. It's in perfect range, and your blood pressure was good as well. And do you have an emergency contact? Okay. And how do you spell that? Okay. And what relationship do you have with this person? Okay. It's your mother. I'll need your address. And your physician before here. Who's your regular doctor? Okay. And I'll need the phone number of your emergency contact. Do you happen to have your physician's address or phone number? No, that's fine. We can just look it up later. We tend to know all the doctors in the area, so you're okay. Okay. When was the last time you had a physical exam? Okay. Have you ever had a stress test? Were the results normal? Do you take any medication on a regular basis? Can you tell me those medications and the reasons? Have you recently been hospitalized? Do you smoke? It can be anything. Yeah. Okay. Are you pregnant? Is there a possibility you're pregnant? Do you drink alcohol more than 3 times a week? Is your stress level high? Do you work a stressful job? And are you moderately active? Do you suffer from high blood pressure? High cholesterol? Diabetes? Now we're going to go over some family history. Parents or siblings prior to age 55, did they have any of these that I'll name off? A heart attack, stroke, high blood pressure, high cholesterol. Does anyone in your family suffer from any sort of heart disease? A heart murmur? Chest pain? Yeah, these can be to the best of your knowledge. We realize you're not going to know everything about your family history. Okay. Emphysema? Any metabolic disorders? Okay. Cramping, pains in legs or feet? Epilepsy? Asthma? Back pain, it can be middle, lower, upper, just general. Any joint pain? Okay. Muscle pain? Okay. Seems that we're good to go. Okay, let me check, go over this one more time. Are you allergic to any medications? Good. And what's the reason you're here? Do you want just a general checkup or? Oh, okay. They're gonna do a little bit of an exam as well as dress that wound. If you don't mind, just, it won't be any extra. Okay. So now we have your medical history, and we're gonna go into a little room, and I'm going to dress your wound and perform some very normal exams. Just check you out to make sure everything's okay. Alright? Great. So let's go do that. Okay, so I'm gonna dress your wound, but before I'm going to just take a look inside your mouth and check your pulse, if you don't mind. So if you'll just give me your hand, and I'm just gonna feel and count in my head. Okay. Everything feels good. You seem very healthy. Now, I have this little stick right here. First, I'll be putting on some gloves. Make sure. So. Now I'm going to need you to open really wide and stick out your tongue. Okay. Go, good. If you could cough for me. Great. No swelling. Now I'm going to feel right here. Okay. Everything seems normal. Checked your temperature and it was fine. And I'm going to look inside your ear real quick. Okay. Don't see anything. They look very clean. You want to keep it clean in there. You don't put Q-tips in your ears, correct? You don't want to do that. Okay, now that we've checked that, we're going to look at this little boo-boo you have. Okay. So first what I'm going to do, it's not too big a wound, but I can see that you just want to be careful. So we're going to use some alcohol. To prep the area and disinfect. Now, this is going to sting a little bit, okay? But I promise it'll be over very quick. And it's for the greater good. I'll see if I can give you a lollipop afterwards. Okay. It's okay. It'll be alright. Just getting it nice and clean. I'm just gonna dab it so I don't disrupt the area. You're doing really great. You have a little bit of debris in there, okay? So I'm going to take a Q-tip and just get it out. We're going to use these prep pads. They're called Quick and Clean. Okay? These are good for cuts and scrapes. Highly recommended. And this will not burn, okay? The scent is nothing like alcohol. It's just very faint. Now I'm going to take a Q-tip again. We're going to place some ointment on there. This will speed up the healing process, prevent infection. We just use an antibiotic ointment. It's a jelly consistency. The other painful part is over. And I'm going to dress your wound now. Open it up, place it on. There we go. This will keep it nice and clean. Let it heal up. And you're good to go. Okay. But before you go, I'm gonna give you a little form. Give to all patients. And basically what it is my pen, is a first aid guide to keep at home. And we just have numbers for doctor. We found your physician's name. We have our number on here. Poison control, the hospital, police, fire department, and I'm going to give you a 24-hour pharmacy's number just in case in the future. We also provide the same thing in Spanish on the back, but I'll show you. It has CPR instructions if you need to perform it before you can get some help, and some symptoms and treatments for home, such as external bleeding, internal bleeding, burns, thermal and chemical burns, electric shock, fainting, fractures, and most of these will tell you to just go to the hospital, but it'll also give you the symptoms to make sure that that's what it is. But you always want to go to a professional just to be sure. And I think we're done here for today. I hope you have a very pleasant experience, and I hope you heal up perfectly. Okay. Have a good day.